Hello, I'm Dr. Shane Keene. I'm the Program Director for the BS Completion Program at the University of Cincinnati. I'm also the Department Head for Analytical and Diagnostic Sciences. I'd like to welcome you to our TOOC, which is a targeted open online course designed for respiratory therapy students who are currently in associate level programs who are thinking about getting their bachelor's degree, and for existing practitioners who are looking to move into a BS completion program. So welcome to our course, Shared Air. And a little bit about a TOOC, some background information. That's kind of a coin phrase we've came up with. It's an adoption of a MOOC, but it's really a targeted open online course because it's really segmented towards respiratory therapists. All of the content's developed specifically for those interested in pursuing a bachelor's degree in respiratory therapy. A lot of what's going on in the future will definitely require a baccalaureate degree or higher level of education in respiratory therapy. Currently, roughly 80 to 85% of the educational curriculum in respiratory therapy is still at the associate level. The American Association for Respiratory Care has outlined as part of their strategic vision is moving forward. They would like to see 80% of the workforce be at the baccalaureate level by the year 2020. So our program here at the University of Cincinnati really falls in line with those goals. We're designed really for working adults trying to complete their professional component degree beyond their associate level. In current practice in the field of respiratory therapy, we're starting to see a huge trend. The expectations of practitioners are being increased. The actual workforce is creating stipulations that we've never seen before. And entry level into practice is really being dictated not only by the demands of the workforce in hospitals and hiring organizations, but state licensure bodies as well. In recent times, as late as last year, we've actually seen 2 states change their entry level requirements to be a practitioner from the CRT to the RRT. Of course, all the CRTs that have a license are grandfathered in and still have the ability to work, but it really shows a true causal effect of what we're doing to try to move the profession forward. Several other states have showed interest in changing their licensing requirements to the RRT as an entry level as well. Even more in depth, certain states have actually entertained the idea of going to a BS degree. And the way that this is allowed to actually be facilitated is market conditions. Right now we have a surplus of respiratory therapists. We have lots of respiratory therapy programs putting out a multitude of students, and as a result of that, the market can dictate versus the practitioner what the standards have become. So I think in the future we'll see that continue to grow, that not only the entry-level credential requirements will change, but in certain areas, especially where there's huge surpluses and there's major medical centers, I think you'll see a BS actually become the standard to be hired in. We've already discussed the benefits moving forward of having a bachelor's degree in the future for longevity, mobility, upward advancement. What I'd like to do now is really tell you about the course, the TOOC we've discussed, the benefits to you as an individual. The course is set up to where you can work at your own pace. It's designed in 5 unique modules, and it's totally tuition free. So you really can get a sampling if you're wondering about if you wanted to go back, get your degree, you're skeptical, you're able to test the waters before you fully commit. Once you come into our program, if you choose to, you actually will get college credit for attending the course. If you choose not to, then you get the benefit of the knowledge. A little bit about our program, the respiratory therapy program, the BS completion at University of Cincinnati. If you choose, once you've completed your TOOC, to come into our program, once you complete 1 semester of coursework, you can apply the TOOC as 3 to 5 credit hours of credit towards your degree. Our program here is completely online, 100%. There's no face-to-face requirements, and you can be complete in 20 months from start to finish. We hope to see you in the course and hopefully in our program in the future. Thank you.